Bismillahirrahmanirrahim. Today our next topic in disease of anterior pituitary is acromegaly. Yesterday we discussed hyperprolactinemia and today our topic is acromegaly. So acromegaly is also called gigantism in children. Actually, it is the condition in which excess secretion of growth hormone occurs. So when this excess secretion of growth hormone occurs after puberty, so it is called acromegaly. And when this condition, when this secretion of growth hormone occur before the puberty, so it is called gigantism. So as we know, uh, growth plate and bones, growth plate. So before the closure of the growth plates, when the growth hormone increases, so it causes gigantism. And after the closure of the growth hormone, after the closure of the growth plate, the growth hormone increases, so it is called acromegaly. So this is syndrome of excess secretion of growth hormone after puberty. And it is insidious and chronic. Insidious means that it gradually increases, and the one who have the condition acromegaly, he didn't notice that he have acromegaly. This is called insidious. It is asymptomatically increases the symptoms. So it is associated with the overgrowth of the bony tissues and the soft tissues. In the soft tissues like vessels, heart, liver, and all these occur in. So it is due to the pancreatic tumors, which is called somatotropic adenoma, and 75% of the growth hormone acromegaly is due to somatotropic adenomas, and 20 rare 1 or 2% is due to neuroendocrine. Neuroendocrine adenomas are we can also call is carcinoid tumors, which is outside of the pituitary in the other organs like in the thyroid gland, in the lungs, in the GI tract, etc. So these are neuroendocrine or carcinoid tumors which cause 1%, but it is very rare. And growth hormone up to 20%, 20% of growth hormone is released in every pituitary tumors. Like yesterday we discussed that the prolactinoma can increase the hyperprolactin level. So when we have prolactinoma, so there is a chance that there will be also increase in the growth hormone. So 20% of the growth hormone is released by other tumors of the pituitary glands. One more important about the physiology of the growth hormone. Your growth hormone is inhibited by somatostatin inhibited by glucose overload, and it is stimulated by growth hormone releasing hormone from hypothalamus. So about the glucose and somatostatin, they inhibit the growth hormone, so it will help us in the diagnosis of the acromegaly and the growth hormone indication. So we have to keep in mind that glucose and somatostatin inhibit the growth hormone release. So next is the clinical features. So what will be the clinical features in a person who have increased growth hormone and acromegaly? So he will have enlarged feet and hands, because the bone size is increasing in width, so that's why his hands and feet will be increasing, and the hands will be spade like. Increases of the shoe, hat, glove, and ring sizes will be increases due to increase in the bone size. So other is the enlargement of the mandible. The mandible will be increases, so it will cause prognathism. Prognathism is the condition in which the lower jaws is in the forward and the upper jaws is in backward condition. So it is also it can also cause underbite, in which the lower jaw is move forward and the upper jaws remain backward. And teeth separation is the enlargement of the mandible, so there will be separation in the teeth. Okay, so next is the deeper voice. Next clinical feature is hyperhidrosis. Why will be there hyperhidrosis? Because of the increase or the enlargement of the sweat gland, so there will be hyperhidrosis. Hyperhidrosis is increased sweating on the feet and the body. So there will be also enlargement of the heart, as I told you that is soft tissues enlargement, also spleen, liver, so it will enlargement of these organs. And there will be hypertension, but that hypertension will be Peripheral hypertension. Peripheral hypertension will be due to the peripheral resistance because the body weight increases. So that's why the body height, the body size, everything increases. So the peripheral hypertension will be increases because of the increase of the body weight, the body height, and the body size. And there will be visual field defect. Why will be there visual field defect? Because if there is adenoma of the somatotropic, so it can block the optic chiasm. So of the suppressing or compressing of the optic chiasm, it can cause visual field defects. Metabolic disorders like glucose disorders and other metabolic disorders. Obstructive sleep apnea is due to enlargement of the tongue. So that enlarged tongues can cause breath apnea or stopping of the breath at the night. So that is why it is called obstructive sleep apnea. Next is the diagnosis. The patient have symptoms for 9 years before he diagnosed with the condition of the acromegaly. As I told you, it is insidious, so that's why. Oral glucose test we can perform. We will give 100 gram of glucose, and after 100 gram of glucose, we will see if the growth hormone is greater than 5 nanogram per milliliter. So it means that the patient have acromegaly, because the growth hormone, as I told you, that the glucose suppress, the glucose decrease the growth hormone. So if the growth hormone didn't decrease from 5 nanogram, so it means he have a condition of acromegaly. Next is the measurement of insulin-like growth factor 1 and somatostatin. In adults, we measure insulin-like growth factor 1, and in prenatal age or prenatal stage, we measure insulin-like growth factor 2. It is the investigation of choice. Then after the biochemical confirmation, that after the oral glucose confirmation, after the IGF 1 confirmation, somatostatin, so then we can go for MRI. MRI is superior to CT scan because it will give us the exact location, exact size of adenoma present. In the management, the treatment of choice is transpyramidal surgery. It is a surgery in which the surgeon do through the nose and the sphenoid bone. That's why it is called transpyramidal surgery. The drug of choice is somatostatin analogues. As I told you earlier, that somatostatin suppresses, reduces the growth hormone. So if we'll give somatostatin analogues, so the growth hormone will be decreases. It is octreotide and lanreotide. Then we can use dopamine agonist like cabergoline and bromocriptine. So it decrease growth hormone and decrease insulin-like growth factor 1. Okay. Pituitary is the second line drugs, and it inhibit the binding of the growth hormone to its receptor in the liver. So that is a second line drug. That was all about acromegaly. If you have any question, you can ask me in the comment box. Thank you. See you in the next video.